On the topic of coarse, grainy images, you will encounter the images sometimes that will be that way because of patient anatomy or metal in the mouth or a little bit of motion. Here's an example of a patient who's got all three. Notice there's implants that are a little bit causing a little bit of scatter, and also there is metal crowns, and there is a little bit of motion from the patient. The patient's a little bit on the thick side as well. So the images can come out a little bit coarse and grainy depending upon the particular patient that is being scanned. One way is to start with the window leveling. If one can change the window leveling either with the icons on the right, tooth 1 or 2, bone or soft, or one can hold the right and left click together and change the window leveling. Sometimes that has an effect to help, and sometimes not so much. There is a lot of artifact that you will get off metal, so that's just the nature of the way the scan is being performed. So you'll have to kind of live with the little metal artifact that comes off metal at times. Now, there is another feature that we recommend. You can select a feature on the software. If you look to the right, there's a tab called Raysum or X-ray summation. What you can do is click that, and you'll notice the inherent slice thickness is pretty low, 0.07. So by selecting Raysum, you can thicken up the slice. Now to do this, you can take the down arrow on the menu, and let's take it to, let's say, 4 times the slice thickness. Okay, now you'll notice that it has thickened up and maybe helped a little bit with the image quality somewhat. Now, the more dramatic effect is going to be seen in the coronal and best and sagittal. For instance, let's take the Raysum box off. This is without the Raysum applied, and this is with Raysum. So you could see, just launch a regular sagittal study, and we'll take the Raysum off, and we'll put it back on, and you can see it basically the image quality becomes a little bit better because of the slice thickness. Now we can even increase the slice thickness. Here at 4 times the slice, it's 0.58 millimeters. We take it up to 7, we get about just a little bit over a millimeter. Now again, we double click it, you can notice the difference. Uncheck Raysum, a little more grainy. By checking Raysum, it smoothens the image up quite a bit. So feel free to use this feature. Again, this isn't even the most grainiest image you'll ever see. You'll have patients of various different image quality that comes across. One patient may look beautifully, the next comes across as quite grainy. That's pretty common with the CT scan. So just realize that you can circumvent that somewhat by applying the Raysum feature or window leveling to help increase your smoothness of the image. Now, one other note, one can take the slice thickness a little bit too high, in my estimation, and here we are at 16. The slice thickness is 2.34. Now it becomes a little bit too fuzzy. So there's a point of no return in my estimation. So again, just kind of select the Raysum slice thickness. Kind of 4 to 10 is usually a good selection in my opinion, and I like 7 because it takes it to a nice even number of about 1. So just realize what it's there for, how to use it, and how to correct for grainy images if they're somewhat bothersome to you. One other note, if your Raysum box is selected and you go up to your toolbar to select your pixel value density tool here, if you select this and bring it into the field, notice it will not activate. You must uncheck Raysum, and then your pixel value density arrow will be activated once again. Okay, so just be aware of that. And I would suggest once you've selected Raysum, when you finish with it, uncheck it, go back to the regular window level, and that way you'll go back to your default position. So you'll have the ability to put on your pixel value density tool once again. In concluding, Raysum only is a working feature on the CT images. It has no bearing on the 3D image, okay? So just be cognizant of that when you go apply Raysum, that you're applying it mostly for the CT images. Okay, this concludes the little section here on Raysum and correcting for coarse, grainy images.